into session on this open meeting, and welcome all of my colleagues. So thanks for joining us today. Today, item number 1 is a presentation regarding CARES funding. This is a presentation and discussion regarding the allocation of CARES funds. So I think because she's first in order, I will ask Leanne Bone, Assistant County Manager, to come up to the podium and start a presentation.
Thank you, Mr. Chairman, members of the board. So we have a presentation here to talk about how we recommend spending the county's CARES Act funding. I'll be doing this presentation with Marcy Flanagan, our Executive Director of Public Health, and also Bruce Liggett, our Human Services Director. And I have to make sure I use the clicker thing correctly.
That's not on. Fran, a quick question. Our monitors are not on. Are we just to read up there? Because these two guys don't have a monitor in front of them. Let the record state that 2 of my colleagues are right down here too that I can keep an eye on. Yes, I believe we're only on the television. Okay, great, thank you.
You can just advance them too. Okay, so next slide, please. So at the end of April, the county received $399 million in coronavirus relief funds. That's a subcategory of the CARES Act that you've heard referred to, and money specifically given to states, cities, and towns to respond to COVID-related issues. So we've identified 6 broad areas that we're recommending for funding today. Those are listed here. So they're essential public health response, making county services and workspaces safe, homelessness response and prevention, supporting individuals and families, supporting small businesses, and covering unplanned costs resulting from COVID-19. And while we're going to be discussing these in some detail today, I just need to recognize that the COVID pandemic is evolving constantly, and so are the needs of our community and the needs of the county. In addition, the federal guidance continues to evolve. The Department of Treasury is regularly updating their guidance on how we can spend these monies, but those have been updated every couple weeks, and we do expect that to continue. And so how we recommend spending these monies may change as a result of those changes in guidance. And also I want to mention that although we're going to be talking about an overall and comprehensive spending plan here, we've identified these broad categories with subsets within them to allow for some flexibility. As we learn more, which seems to be happening on a daily basis, we may decide that some money needs to be moved between categories, and any major shifts, of course, we would bring back to the board for consideration, but we want to make sure that we stay flexible in this space as well and can respond to the needs of the community and also our employees and customers. Our first category is essential health and emergency response, and we're recommending $83.5 million be allocated to these efforts. And we further subcategorize this into 2 different spending areas. One is protecting our residents, which focuses specifically on the public health response to our community at large. And then the second is protecting our most vulnerable, which focuses more specifically on the populations who are most at risk for the most serious health outcomes. I'm going to turn it over now to Marcy Flanagan to talk about this slide and the first half of the next slide.
Great, thank you, Leanne. Welcome, Marcy. I know that you've been working hard over these last, what's coming into several months, unfortunately, but thanks for being here and joining us today.
Yeah, thank you, Chairman, members of the board. So I'm going to talk about a few things we're doing in detail. The first is contact tracing. So with those efforts, we are approaching it with a multi-prong. We are having a contract in place with Arizona 211, who will be doing the majority of the contact tracing. We are also adding approximately 102 individuals to the public health workforce, and those individuals will be trained in doing the case investigations. So we will initially reach out to individuals through our investigations. Once we develop a list of who their contacts are, those will be given over to the AZ211 to do that follow-up contact tracing. So The majority of the funds, 2/3 of the funds will be in that contract, and the other will be in our department for the additional staff we're bringing on. We're also entering into agreements with ASU and U of A, and they're going to be utilizing students and also the AmeriCorps Vista volunteers to help in contact tracing efforts throughout the summer until we get all of our staff up fully trained and operational. For COVID testing services, $25 million, that the majority of that is going to go towards testing in long-term care facilities and congregate settings, such as those experiencing homelessness, and also supporting our correctional health services with testing efforts, and also smaller jurisdictions when we're seeing hotspots or areas that are having large numbers for small communities, that we can provide support services and testing services in those communities. Our enhanced flu vaccination, part of this fear is that when we move into our fall months, this season's flu may add to overwhelming our hospital and healthcare systems. And when they're already feeling the strain of the COVID patients that they are handling, that having flu patients present with very similar symptoms as COVID and needing hospitalizations, it will just break our system that's already burdened. So we are going to be doing a huge flu campaign, providing more flu vaccine than we've ever provided in Maricopa County to the community, working with our pharmacies and healthcare partners to provide flu vaccine drive-through clinics, and just anywhere that you go in Maricopa County that you could receive a flu vaccine for free or covered through your insurance if you have it. The last is ongoing emergency preparedness and response. And really that is just to, as we monitor the situation, things change and rapidly evolve because coronavirus is new and we haven't seen it before. It's important for us to have a dedicated amount of money. So as new recommendations and requirements emerge, we have the funding set aside to address those quickly and really take action immediately so that we can protect Maricopa County as much as possible, the residents that live here. So the next slide, am I changing it? You got it. Is our infectious disease guidance for long-term care facilities. As we know, this disease unfortunately is affecting those that are most vulnerable or over the age of 65 and also have underlying medical conditions. Our long-term care facilities unfortunately have been really hit hard and devastated with when this virus goes into one of those settings. So we are currently working on an RFP that actually closed today. We're excited to see the responses we got from that, where we will have providers on contract that will be able to go in and not only provide testing services, but also some infectious disease education and help with developing some mitigation strategies and cohorting strategies and just an overall infectious disease plan to help those facilities attack and kind of cohort and eliminate the outbreak as quickly as possible. The next is personal protective equipment for healthcare workers. It says healthcare workers, but this will also be for first responders and any of those that are on the front lines providing care to individuals they may come into contact with that are positive with coronavirus. So that amount of money is what we believe will kind of get us through helping to provide those necessary personal protective equipment to those facilities and agencies. And Bruce, I'm going to turn it over to him, and he's going to talk about the senior assistance.
Mr.
Great.
Chair?
Yes, Bill.
Would it be all right to ask questions now?
Sure,
Before I go
absolutely.
to homelessness?
If it's okay with
Yeah.
Marcy.
So, Marcy, I would echo the chairman's comments from the very beginning at the end of January. I know that your team has been working 12 to 16 plus hours every day, so we're so grateful to that. The contact tracing, I wanted to kind of focus on that a little bit. So as you went through the various, you're hiring new people. We have folks coming from ASU, U of A, AmeriCorps, and 211. So when you put all that together, how many people would you say here, once you're up and running, how many people will you have working on this contact tracing on a daily basis?
So in the Department of Public Health, we'll have nearly 200 people working on it. The contact tracing and investigation component, when you look at the AZ211, they are looking to have 50 to 100 individuals on board with them. ASU has about a cadre of 200 individuals they're working with, and U of A has another about 40 to 60 individuals. So when you put all those together, doing the math real quickly, we're going to be approaching 500 individuals that'll be working on this assistance for contact tracing.
That's great. I'm really pleased to hear that. We do have some people in the community who have privacy concerns about the contact tracing. Can you address that a little bit?
Sure. So when we do contact tracing, we're not sharing the individual of who potentially may have exposed them, and we're also not sharing the person who has been in contact with any agency outside of public health. So the requirements we have in public health are actually stronger than HIPAA requirements. So when we do disease investigation, we are privileged to have information from individuals. We don't share that information with anyone else, and any of the agencies that are partnered with us fall under those same regulations and guidelines. They are not given access to the same medical system that we have with the state to do our case investigations. We're doing kind of a step-down Qualtrics system to do the contact investigations, but it'll be very just basic information we get about a contact. So if you are in close contact with an individual who has tested positive for coronavirus, that is more than 10 minutes within 6 feet of an individual who was positive. When we call that case, we'll ask them, were you in contact with anyone for more than 10 minutes within 6 feet? Can you give us their name? Do you have their phone number? And we ask for that information. If they only have their name but they don't have their phone number, we have mechanisms we go through to try to find that phone number, and then they'll receive a call from us. Initially, they may receive a text message that said, please reach out to public health. We have been notified you were in contact with someone. You may have been in contact with someone that tested positive for coronavirus. Therefore, meaning if the text happens to go to the wrong number, the wrong person, we're not sharing any HIPAA or personal information. They reach out to us. We look up and see if their name is in our database, and we let them know the recommendations for isolating and quarantining moving forward. So nothing outside of that is shared. We don't even reach out to their healthcare providers and tell them. And the only situations where we would actually ask for where they work and their employer is if they are working in these scenarios where vulnerable populations. So if they're working in a long-term care facility, that's going to be really important for us to know. And we would say we're going to talk to your employer because you may have exposed some individuals that are very vulnerable.
Great. Thank you for that information.
Thank you, Bill. Great points and great questions for Marcy. Any other questions? Well, Marcy, thank you very much for joining us again. I'll call up Bruce Liggett. Bruce, welcome. And thanks also for your hard work that's been going on over the last several months. So thank you to you and your staff for what you've been up to, what you've been doing for the county.
Thank you, Mr. Chairman. And just to explain, on the previous slide, there was a $500,000 for senior assistance, and that portion of the proposal is for weatherization. We've been running a weatherization program for a long time. We get calls all the time from people who can't afford to get their air conditioning fixed, for example. So this money would allow people who have been impacted by COVID, with a priority for seniors and people with disability and people with young children who need to have their air conditioning restored with a COVID reason, financial or otherwise. So that was on the previous slide.
Great, thank you.
This section then includes, first of all, mitigation measures for homelessness. And as you suggested, Mr. Chairman, we've started some time ago with this and been doing quite a lot of challenging work, working with many community partners who've really been amazing. The Human Service Campus, Community Bridges, Circle the City. There have been regional providers, and we've been trying to work this issue regionally with a focus on where the most people congregate and the most vulnerable homelessness. This has been necessary because, as we've talked about many times, and I hear from the board all the time about homelessness, homeless people don't have a place to go, to stay at home, to stay in place, and so we've got to allow them to be safe also. So the request for $10 million in terms of homelessness covers everything we've been doing and continues it for some more months. The longer the virus, this amount could increase, and that's why the reserve that Leanne talked about, I believe, is important. So most of this money carries us into the fall, but not that far beyond. So what it includes is our 4 alternate care sites, some hotels for people who are under investigation and positive, for people who are vulnerable, and a leased site that we have, about 140 rooms we have spaces for. Includes the cost of the voluntary relocation of the tents from the encampment to allow to meet CDC guidelines for spacing. It covers a significant investment in hygiene for people who are homeless, hand washing stations, toilet facilities, all the necessary essentials, and also the hotline we put in place for shelters and hospitals to use when they see someone who's homeless, may have symptoms or may be being discharged, and enter back into the system. So this investment in homelessness will allow us to continue our work and to monitor the situation and respond as needed. The second piece of this is eviction prevention. And this is a significant increase in eviction prevention. We've done rental assistance programs for many, many years also. So we have ongoing money that we provide, less than $1 million in various fund sources with different eligibility. We received some direct money from the federal government that didn't come as part of the county CARES package that is also included in some of our work. This $30 million will allow us to design a program that should be operationalized before the moratorium on rent increases expires, both the federal and state, and before the reduction of the unemployment insurance benefits, the federal benefits that are there. This will allow us to provide a minimum of 18,000 months of rent assistance for 6,000 to 7,000 people who will be coming. What we want to do is ensure that there is full accountability. There has to be a COVID connection, loss of income, or other circumstances related to the pandemic that resulted in that loss of income that requires them to get a rent assistance payment and to prevent eviction. We want to do it in a streamlined manner and yet ensure transparency in how we do this. So we've been consulting with the industry on this, and we've been talking to other groups, learning from our own experiences, and hope to be able to operationalize if approved by the board in July.
So, thank you. This has been a topic that not only our board, but boards prior to us found that it was extremely important to Maricopa County, which is the homeless issue. I know that I would just go to Steve Gallardo if you had any questions. This is always an important issue to all 5 of us, but centrally, you've kept us well informed and been working with these groups. I'm just wondering if you have any questions for Bruce or anything.
No, thank you, Mr. Chairman. I do want to thank Bruce. He did meet me out there last week. I went ahead and took a tour of the lots that were created to allow for social distancing amongst some of the folks that were there homeless. And it added there were water stations. They had the restrooms and all the services that were needed to help those folks that were out there. There's no question, and I know there's folks that are listening, and much can be done, much needs to be done. And the one thing that I continue to remind folks that we here at Maricopa County, and I believe we would all agree that we do share in that responsibility, but it isn't just Maricopa County's responsibility, it's everyone's responsibility as well as Phoenix, the state, and surrounding municipalities. It's everyone has to do their part to really address this vulnerable population. But we're in a unique situation right now with our homeless population, because how do we try to deal with some of the challenges that you normally have with homeless? At the same time, now you're on top of that, you have the COVID-related issues and the social distancing, and now we're coming into our summer months, and how do you deal with the heat-related issues? We talked about how St. Vinny's was a great partner, still a great partner, but was truly a great partner for the past few years by allowing them to open up their dining halls and all that stuff, but that has changed some as well. But this goes a long way. It really does, and particularly when it comes to the eviction prevention. I think that's something that I think we all kind of think about. What are we doing as a society, as a government, to help those that keep them from becoming homeless. And I think the CARES money that we have was specifically entitled to that. It's a crisis money. How do we help those from becoming homeless? Those that have lost their job because of COVID, those that are struggling right now. There's a lot of, the unemployed, we talked about the unemployment numbers regularly down here. A lot of folks unemployed that are having a hard time just trying to, put food on the table, let alone the utilities and all the other stuff that goes along with it. So what can we utilize the COVID money for, the CARES money for? And that's exactly what it was intended for. It was intended to be used for our individuals that are just about to be evicted. How do we help deal with some of the homeless situations in terms of COVID-related issues? So I think we're doing exactly what we need to do. I think there's always room to try to do a little bit more, but as we all know, we're crunched in time, and we have to have everything kind of done before the end of the year. But I think we're on the right track. I think Bruce's team and all the folks that are down there, all our partners, are doing a great job in servicing this vulnerable population. But I just want to continue to remind folks, this is everyone's responsibility. It really is. This isn't just Phoenix or Maricopa County or the state. This is everybody's responsibility. How do we work together as a society, as a state, to ensure that we're taking care of this population and servicing the families that are just about on the verge of being homeless because of COVID. So I'm pleased to see the amount of money that we're investing, particularly in this time right now. And I think this will go a long way. So I'm pleased to see what we have in front of us.
Great. Thank you,
I guess
Steve.
more of a statement than a question.
Should we continue on? Okay, thank you, Steve. Thank you, Bruce. Appreciate it. Leanne.
Yes. So our next category is Safe County Services and Workspaces, and we're recommending an allocation of $77.5 million for this, broken up in a couple different subcategories. The first of those is serving our residents, and we're suggesting a $41.5 million allocation for this, and in 3 different categories listed here. The first being parks enhancements. So I think we were all thrilled in the spring months to see our parks really heavily utilized, understanding it's a great way for people to get out and stay connected, but still stay safe at the same time. And we want to make sure that enjoyment of our open spaces can continue, but can continue in a safe fashion. So the money that we're recommending for this category would help us invest in cashless payment systems, portable messaging boards, water and septic systems, hand washing stations, and some enhanced cleaning of restrooms. Next, we have expanded online services, and we're recommending $12 million in that subcategory. So I guess one of we talk sometimes about the silver linings, and maybe a silver lining of our CARES Act funding is that it allows us to invest in things that are necessitated by COVID and the need to socially distance, but also may have long-term benefits for the way in which we do business. We'd like to invest in options that allow us to help our residents do business remotely when that makes sense to do that. And so in the coming weeks, you will see requests from our court system to expand online payment options and also to expand e-filing. And our elections department as well is hard at work figuring out how they can deliver a safe and inclusive voting environment in the age of COVID. Lastly, in this subcategory, physical safety enhancements, so that the county is big and the county has a lot of physical sites, and we want to make sure that when staff and or county residents need to come in and do business, they can do so safely. And so this is a range of different services, from enhanced cleaning of high-touch surfaces to cubicle redesign in some of our areas that have lower cubicles, and also some physical distancing enhancements. We also recognize that we have a responsibility to protect our employees as they deliver public services to all in Maricopa County. And we have 2 different items in this. The first is expanding remote working capabilities. In In March, the county transitioned many of its workers to a telework environment. We do employ over 13,000 employees, and a good number of these have worked in some telework capacity since that time. And I think it's made us rethink a bit how we can deliver services and where we can deliver those from. And so we'd like to look at how we can make that that telework environment more robust, so that those services can be seamless to our customers and keep our staff safe and as effective as possible working in those alternate environments. And then last in this category, the Families First Coronavirus Response Act provided enhanced leave to employees. And so this is for people who are either experiencing COVID themselves or taking care of a loved one who has COVID. It also includes families who may have lost childcare options through school closures or daycare closures. So there are enhanced leave options, and we do pay those payroll costs. So there is money set aside for this. Related to that, if we have staff who cannot come to work for those reasons, in some cases we are paying overtime for other staff to backfill those positions. So we want to make sure that we have that covered as well. Our next category here is healthy individuals and families, and while we don't have CARES Act or coronavirus relief funds specifically for this, there are other CARES Act monies that are being given to the county from the federal government, specifically to human services. Those supplement our greater efforts, and I'd like Bruce Liggett to come on back up and just talk a little bit about those.
Great.
So yes, as Leanne said, these are monies that the county received but didn't come through the full county amount. They came to our department as normally some of those federal funds flow. So some of them, and you're familiar with the Community Development Advisory Council that you've appointed, some of the money they help us plan, and what we did is with that fund, we asked the cities what they would like to have in. So here you see how the cities have helped guide. There's money that they also want for utility assistance, rent assistance, so there's some additional monies here. Everything we're doing, because the amount of utility assistance we receive is increased by $2.4 million from federal CARES Act related monies. It's going to be combined. So if we're talking to somebody about rent assistance, how are they doing with utilities? They got to pay those bills too. So we're going to blend 7 or 8 different programs we have to try and supplement the rent assistance for families to keep them stable. Some of the cities asked for money in senior services, for bus routes to take people to their appointments during the COVID crisis. And then we received money from Health and Human Services to begin planning for the school year, which we're spending a lot of time doing as we begin to look at young children coming back together in the classrooms. And we're staying current with the guidance from the federal government and from the governor's office in terms and the Department of Education on that. So these are additional money beyond the almost $400 million county money.
Thank you, Bruce. Next, we'd like to talk for a minute about supporting small businesses, and we're recommending $23 million be set aside for this initiative. We know that many small businesses have experienced sharp declines in revenue, and some had to shut down entirely during the stay-at-home order. Many are struggling to make ends meet and may even be having to rethink how they deliver services. Phoenix and Mesa, as we all know, have already deployed small business programs, and so we've been keeping an eye on those programs and keeping an eye on what works and what makes sense and how we might do something similar in the county to support businesses in a similar fashion. What we'd like to do is ask the board for the board's support in taking the next several weeks to develop a similar small business program and bring it back for approval in about a month's time. Again, using that $23 million amount as an earmark. I guess one other thing that I'd like to mention in this category, although the CARES Act funding that we receive, we have not specifically set aside money for workforce development. We are receiving an anticipated $4 million in additional Workforce Investment and Opportunity Act funding. And so we began ramping up our workforce services in April when we saw the unemployment numbers spike, and we will continue to respond to that. So that too is that funding that comes through our Human Services Department and just adds to the overall robust response that the county can have to this crisis. Okay, our last category is planning for the future. So we do have a large amount here, $175 million is recommended. What we know about the coronavirus pandemic is that it's changed constantly. The day that the situation that we're in today is not anything we could have predicted in February, March, even in April. And so we know that we need to stay flexible in the current environment. In addition, a lot could change with the guidance from the Department of Treasury. These funds are right now set to expire on December 30th. What we believe is this pandemic will be going on much longer than that, and there is active discussion about that deadline being extended. There's also discussion about expanding the approved usage for these funds. In addition, we don't know what the needs of our community might be moving forward. So we want to make sure we set aside a health reserve so that we can be flexible moving forward and respond to those needs quickly. And with that, that is our presentation.
Okay. Well, thank you for that, Leanne and Bruce and Marcy. I will look towards my board for any statements or questions. Supervisor Chukri.
It's more of a comment, Mr. Chairman, and it goes to actually all three, Leanne, Marcy, and Bruce. The three of you are saints and your teams, and I don't say that lightly for what we've encountered, which is really unspeakable. Everyone says this is unprecedented, but it's almost unspeakable. So going through, I know that there's been a lot of collaboration and discussion, and what has come about in today's presentation simply did not happen overnight. It was well thought out. I think to my colleagues, to you, Mr. Chairman, and for your leadership about making sure we were thorough in leaving no stone unturned, because with this type of monetary influx to the county comes great responsibility. I know that Mr. Gallardo had concerns with his district. We all have, that were nuanced, and I think we addressed that in your plan. Homelessness is a major issue. I echo Mr. Gates's comments about it's all of us. Mr. Gallardo's comments, it's all of us that are responsible in this way. And then from how these funds are distributed, I know that you have to have experience in doing this, and I know that there's entities here in the metro area that have that great experience, that don't charge astronomical administration fees, and that the money goes to where it needs to go. And Bruce, you're always exceptional at making sure that we do that correctly with little loss of funds going to those who need it most. So it's not a question, it's a comment about all 6 or 7 of these categories that we touched on this afternoon. And thank you. I think we're doing this very responsibly, keeping that $175 million to the side to make sure that we anticipate where or how this may go as we progress through 2020, which has been quite the year, as we can all attest. So thank you, Mr. Chairman, to you as well, and to these great county representatives.
All right. Thank you, Steve. Bill.
Thank you, Mr. Chair, and would echo Mr. Chukri's comments. Thank you, Clint, to your leadership throughout this, and being on those calls 8:30 every morning and keeping us steered in the right direction. And this is a great example of it here. You know, not jumping right at this, but taking the time to really evaluate this seriously and come up with what I think is a great plan. Thrilled to see the amount of funding that's in here for contact tracing and testing. You know, the stay-at-home order has been ended, and so now it's all about getting out there in a safe way, and I think Maricopa County is key to this. We have to have a vibrant contact tracing program, and we've got it, and this program supports it. We've got the funding to do testing. The testing is going to have to continue, extensive testing. That's the only way we're going to be able to move forward in the months ahead. Very supportive of the component on small business support. Our small businesses have been hurt greatly. And so if we can provide assistance to those small businesses, they're outside of Phoenix and Mesa, they're already being addressed in those municipalities. I think that's going to be a very positive thing that we can do. Also wanted to thank the congressional delegation, which made this a reality for us, and appreciate the support that they gave us. And finally, this $175 million for future expenses, which might look like a big number to people, but we have to remember we have almost 6 months left in which to spend this money. 6 months ago, we were just starting with coronavirus. We were just as a planet.
Yeah.
So we think about how far we've gone in 6 months. It is the right thing to do to set that money aside for the twists and turns that are going to come that we cannot even anticipate. But this way we'll have the funding that our residents need. Thank you, Mr. Chair.
Thank you, Bill. Steve?
Thank you, Mr. Chairman. Yes, also just want to kind of echo Shukri and Gates's comments. Thank you, Mr. Chairman, for your leadership and our great team here at Maricopa County. As Gates indicated that, if you would have told us about 3-4 months ago maybe that we would be sitting here trying to figure out how we're going to spend $400 million in 6 months and how are we going to deal with, you have an unemployment rate of what, anything from 13 to 18%. Nationally, I'm not too sure exactly what we have in the state, but it's huge. Because I see it every day talking to folks. We have businesses that still continue to struggle right now to get their doors open. I've talked to small business owners who said, Steve, I just don't have the reserves to reopen. I just don't. I want to. I just don't. I just didn't have that set aside. I was not prepared for that. You have small businesses that are now reopened and they're still struggling. There are businesses that have never closed but are struggling. I have a little dry cleaners. Little family-owned dry cleaners I have in Avondale, and been there I think like 13 years, and they're down to a skeleton crew. It's the husband and the wife are doing the whole gamut, and they laid off like 20 employees, and they're just struggling, and they're hoping that things turn around soon, or they're really going to be in a world of hurt. You have a healthcare crisis. You have families that are scared to even go outside, to even just go to the grocery store to buy food. You have families that are struggling just to have food on the tables. So you're dealing with a lot of issues. Now, on top of that, you have, of course, a homeless population that is growing every day. Most of it because of COVID-19. You have families that are on the verge of being evicted. I was talking about this with my little team, my office, that come the end of July, as Bruce indicated, you're going to have two very critical things come to an end. One is the moratorium on evictions. That's going to come to an end. And then the supplemental unemployment insurance coming from the federal government is going to come to an end. All that is just going to impact families and just make things a little bit harder for a lot of folks. So we're now in front of us, we have $400 million, nearly $400 million of crisis money. And that's what it was intended for, to deal with the crisis. It wasn't recovery money, it was crisis money. So out of all the situations or all the problems we have right now facing the people of Maricopa County, how do we deal with that? And I think you have a very balanced, smart approach here. We're taking care of businesses that were left out of the first and second round of business funds that were provided by the Small Business Administration. You have businesses that, for whatever reason, were left out. How do we kind of help them out? How do we take care of our families that are on the verge of being evicted? We're taking care of that. The contract chasing, which is huge, the huge part of making sure our community is healthy. That's being taken care of. So we are focused on the priorities, the crisis, and I think we're on the right track. No one has a crystal ball in what's going to happen next week, next month, or August or September. So I think it's critical to make sure we have money set aside, and we do. I think we're spending half of it now to deal with some of the problems we have now, and holding on to another half for as we see what happens. So I think we're doing it right. I'm very comfortable with the package we have in front of us. I think we're taking on some critical needs in our community, and with the help of a great team, they're making us shine here. And I think we're spending this $400 exactly the way the federal government intended to be spent, and that was focus on the crisis, focus on dealing with some of the problems we have, and hopefully start to deal with some of these challenges as we move on during the summer. So I'm pleased, and I think we're doing the right thing here.
Great, Steve. Thank you. Jack?
Thank you, Chairman. And I'd like to just repeat what the other supervisors have said. Thanks to our chairman and the leadership of the county staff and our emergency command center. What phenomenal work you've all done. This is a challenge that nobody knew how to deal with, and the way we've come together and worked together is just phenomenal. And I have been so impressed, even with our board, the way that I feel that our board has represented every viewpoint in the meetings where we've discussed this. We really have said, what is the best way to use this money to protect our county and keep our county moving forward? And really, really have been pleased with that. And I guess from my own viewpoint, the thing that I'm most pleased with is that we have this money set aside for future needs, because the leadership in my district that I keep talking to have said to me, Jack, we don't know yet what we're going to need. We're dealing with this the best way we can. It's all new to all of us. And the fact that we're going to have some money as we move forward for things that we didn't anticipate to keep us alive and moving is really critical. So thank you again to all the leadership, and I think we're really approaching this the right way.
Great. Just a couple comments too. I don't want to belabor the point, but I think by serving here for a while, and along with Steve, and then as you guys have come, it really shows just what kind of team has been put together here in a time of crisis, where everybody's doing their jobs and working hard, attending calls, making sure we're trying to cover everything. It just shows just what an effective and great team that Joy Rich has put together. So Joy, because we're getting to work hand in hand with some of your superstars here with the county, and that includes weekends. And that first month was every day, day in and day out, how it's affecting the county resident. Thank you for bringing up the congressional delegation. They made a series of votes to put money towards the local governments, and I appreciate that very much. The other thing is Governor Ducey's office, and talking to them about, okay, what's the state going to do? And know that when you hear these asides about Maricopa County, the great state of Maricopa County, and as I represent sometimes rural interests and talk through CSA and things, I'm glad that the governor and the governor's office put money towards those municipalities to give us a set of money for us to do the best we can for the Maricopa County resident. So I'm very appreciative that they looked at that. I'm appreciative very much of this board. What is it? Money is the mother's milk of politics, is what they say. There was a lot of people all this entire time asking, what are you going to do with this money? What are you going to do with this money? And I kept saying, I think what I'm going to do is ask my board to stay in their zone. We are diligent and we are prudent, and we are going to look at this in the lens of how we do things right in the county. And so we're one of the last boards to make a decision of such import, but I think we're going to be able to do great things to help the county resident, because we've waited a little bit to see what is going on and what this world is bringing. People will look at that presentation and probably look and see those wonderful 5 or 6 slides of what we're doing right now, and are going to immediately start calling us and wondering what the rest of the $170 million is going to represent. And that slide saying we don't know where we're at with this thing. We know the world has changed even since last week with what's going on. So I'm glad that this board is considering just holding still with a amount of money, because we don't know. There might be a lot of people deciding, I wish we wouldn't have spent it all in that one area and wish we would have held it back. Don't know, but at least we have it and we have it identified. So with that, thank you. You
One
guys
last
have been
comment.
very receptive on my phone calls, and so have the other electeds too.
One last comment,
Yes,
Mr.
sir.
Chairman. We've all gotten used to getting calls from our chairman at 5 o'clock in the morning and 10 o'clock at night to ensure that we're all up to date on what's going on. He has really put a lot of effort into this, so thank you.
Thank you, Jack. It's fun. It's fun to destroy you guys' mornings and nights too. That's all based on what the county and Joy Rich and their staff is saying. So thank you for that. So with that, thank you all for being here. And I will move on to number 2, the allocation of CARES funds. And I guess I would be looking for a motion out of my colleagues.
Mr. Chairman, move for approval.
Move for approval, okay, of the allocation of CARES funds according to the presentation. Okay, do I have a second? I have a motion and a second. All in favor say aye. Aye. Any opposed? Hearing none, motion carries unanimously. Okay, with that, we will end the meeting. Thanks, everybody, for coming. Thanks for my colleagues for being here, and we'll continue on with our day.